Hello, this is week number 7, and we're going to talk about LGBTQ plus issues and transgender issues. So, just a little bit of vocabulary, so to speak, because not everybody, I have to make the assumption that not everybody understands what the acronym LGBTQ plus means. So, just right off the bat, it is lesbian, gay, bisexual, transgender, queer, and plus meaning other identities in there, because there's queer and questioning and intersex and agender. Excuse me. It takes in a wide variety of different identities. But when I was coming up, so to speak, in the early 20s, in my early 20s, in the 1990s, early 1990s, it was just LGB. That's all we had: lesbian, gay, or bisexual. And then transgender got added, and the transgender community don't feel like they need to be in the LGBT umbrella because they don't believe that they are lesbian or gay, that they are just transgender. So it just depends on who you talk to say if they're in the LGBT or not in the LGBT. But I do remember in the 90s a big discussion about, is it GLB or is it LGB? Because the lesbians said it's LGB and the gays said it's GLB, but who cares? So I think we finally settled on the LGBT, L coming first, and I think it just rolls off the tongue better. LGBT is also GLBT. Okay, so that's what those letters mean. We're going to again talk about social hierarchy, and if you remember from the previous lecture, social hierarchy has many, many, many different layers. It's like an onion. You peel off layers, you keep peeling off layers, right? But I talk about social hierarchy, and in each topic, I break it down in a very small discussion, a very small picture, so that you can understand this specific topic better. So I don't want people to go out there and say, Professor Kaoki doesn't understand social hierarchy because he only just puts in a couple people or a couple different types of identities. No, I totally understand social hierarchy. It's very complex. But when we have the topic, I narrow it down greatly so that you understand the topic better. Okay, so for the most part, we're just going to talk about LGBT and heterosexual. We're going to talk about men and women and people of color, and we're going to talk about their sexual identity, okay? So in our society, the way to be or the norm is heterosexual, or referred to as heteronormative. That's at the top of this little triangle, okay? That's the baseline, so to speak, okay? So again, we have men, white men, heteronormative or heterosexual. They are at the top. Below that, we might have white heterosexual women. And below them, we would have black heterosexual men. And below that, we will have black heterosexual women. Have you noticed the trend here? So far, everybody's heterosexual, right? Okay, so after we've gone through those first four, now we will have excuse me, white homosexual men. Black homosexual men, white homosexual women, and black homosexual women. What did you notice in like the sixth tier, shall we say, when we had white homosexual men? Black came first before white. Just think about that. In our society, being homosexual will always be lower than any race or color. Okay, that'll always come lowest. So we have a black man who is homosexual, who holds more power in our society than a white homosexual woman. That's one of the few times, if not the only time, a black man will have more power than a white woman. It's because when we throw in the element of sexuality and we have heterosexual and homosexual. Heterosexual will always come out on top, okay? Because our society believes that is the way to be. And they believe that homosexuality is a sin or homosexuality is a defect or whatever they want to believe. They don't believe that homosexuality is normal, is okay. All right? So, let me go back in time to about 1949 when we have this French philosopher, female, by the name of Simone de Beauvoir. I'll spell the name since it's not in class and you can't see it. Simone, Simone, last name de Beauvoir, French, lowercase d-e, uppercase B-E-A-U-V-O-I-R, de Beauvoir, okay? She came up with the theory that there is an other, O-T-H-E-R, right? There is men who are the reigning supreme individual in our society. And if you're not a man, you are looked at as the other, right? They don't even be called woman. You're just an other, okay? And she said, because men hold the predominant role in our society where women don't. They are just there to support their men and to have the men feed off of them, so to speak, for their own needs, like sexual needs is essentially what she was saying. So it's a very interesting concept that she introduced to us in 1949, that women are others. And so you may hear as you go through your life about how people are othered or less than or made to feel like they are not equal, okay? That concept was introduced in 1949 by Simone de Beauvoir. I like saying her name. Then we advance about 30 or so years, 35 years, and we have a woman by the name of Judith Butler who has a different idea on gender. She doesn't necessarily address or talk about Simone de Beauvoir's otherness. She talks about how gender is actually performed. And she's the one that coined the phrase, so to speak, gender is performative. And what she means by that is how we choose to present ourselves is a performance, is what we do. Someone may be physically female or physically male, but they may not always conform to society's expectations of them. So remember, we said that gender roles and expectations are all socially constructed, right? We as a society for several hundred years have determined what it means to be a man and what that looks like. From hair, to jewelry, to clothing, to jobs, to behaviors, to sports, interests, all those things are determined to be male or female, okay? So, when we don't fit in this nice box of what it means to be male or female, we are performing our gender, as Judith Butler suggests. So, for example, I identify as male. I am cisgender, meaning that my brain and my anatomical marker of my penis are in alignment. More about that a little bit later. But there are things that I like, that I find pleasing to me, that society has defined as being for women. For example, you've noticed through the semester I have fingernails that are painted. Does that mean I'm a woman? No, it just means I like to have my nails painted. There are certain things that I like that are women. Like when I shop for clothes, I don't care anymore if I buy it in a women's department or a men's department. If it's an item of clothing that I think is kind of cool and I want to wear it, I will wear it, I'll buy it, and I'll wear it. I don't go shopping exclusively in the men's department. I don't go shopping exclusively in the women's department. I shop in both, and I find things that I like or don't like, okay? One interesting note is when I used to work in retail and I worked at Guess Jeans over at the Arizona Mills Shopping Center, I was the store manager there. I was working one night, and this young couple, I don't know if they're male, female, or they were male, female. I don't know if they were boyfriend or girlfriend or what, or just friends. And the female said, well, remind you, they were in the men's section of the store. Female said, "Oh, these are cool. You should try them on." And he looked at them and said, "No way," because they had stitching design on the back pocket. There was stitching design on the back pocket. He made the assumption that they were women's jeans and he didn't want to try them on. And she said, "Why not? They're cute." And she used the word cute. And that solidified it for him that, no, I'm not going to put those pants on because they're women's. So he's like, "No, I'm not going to try those on." And I turned around and said, "You are in the men's department and those are men's jeans." He goes, "Really?" I said, "Yes." He goes, "Oh, yeah, well, they're okay. Yeah, I guess I could try them on." His idea or perception of those jeans changed when he got confirmation that they were men's. But had he not gotten confirmation that they were men's, he would have continued to believe that they're women's and that they don't belong on his body. So it's very interesting how men, or even women, will decide what they wear, what they do, because they're thinking about what do other men do. And I don't remember seeing a man doing this or wearing these pants or something similar to this. So if I don't remember seeing that, then it must not be a men's thing to do. Okay? And that's kind of the story that I just told about how Judith Butler says gender is performed. We make our gender decisions based on what society has dictated for us. Okay? So it's very interesting. How is gender viewed when it falls outside the norm? Okay? So for someone like me, how do the majority of the society look at me? I get it all the time. I get the long stares, the eyes up and down, because they see a face that looks like a man, but then they see me wearing something that looks kind of effeminate. I don't know, a pair of pants that's got a lot of prints on them or something, okay? Or maybe they see me wearing a pair of flip-flops that have a really thin strap, and they think that might be a women's pair of shoes rather than a man's pair of shoes, because men's flip-flops have wider straps. They don't have thinner straps. Regardless, I get the stares all the time. It doesn't bother me anymore. I find it amusing. But when someone's gender performance falls outside the norm, it makes people uncomfortable. And we see it a lot in our society. When people who are uncomfortable with someone's gender performance, it can escalate to violence, like verbal or physical, right? And it's only because they fear that this person is doing something that challenges their own gender norm. And like, am I doing my gender wrong? Because I'm not wearing what he's wearing, right? That's the psychology behind it. When I was studying gender studies in my master's program, there was so much psychology that when I finished this master program, I went on to do another in psychology because it was so interesting, okay? And what I learned was men dress for men and women dress for women. What does that mean? Meaning is we're all looking to the other person that is the same sex as us to see what they're doing, and they will see and they make a mental note, and when it's time for them to buy new clothes or whatever, they will make sure that they buy something very similar to what they've seen other men or other women wearing, so that when they perform their gender, it can't be mistaken as falling outside the norm. Okay? I want to go on and talk about transgender. And before I talk about that, I want to talk about intersex. Okay? You might have heard that term or may not have heard that term. It's someone who was born with either ambiguous genitalia that can be seen or not seen. Someone may be born with a vagina, but may not have ovaries, but they may have testicles instead. But those testicles, all boys who are born with testicles are in their abdomen. They tend to fall, they do. They fall down or they ascend within the first few months of birth. They will ascend. But sometimes the body is confused. Not to say that the person is confused. Sometimes the body is like, okay, I got an XX chromosome, but why are some male parts also being produced? And the person may not know that they have testes because they never ascended, okay? So when they turn, say, 14 years old and they have yet to have a menstrual cycle, they're concerned. Well, not them personally, because they may not know, but the mother or the father or both, maybe, well, you're 14, you should have had a menstrual cycle by now. Let's go check and find out what's wrong. And they find out that they don't actually have ovaries. They have a testicle. They have testicles or testes. And those are not producing female eggs that don't get fertilized, and that's why they're not menstruating. And they may have a uterus or they may not have a uterus. So the anatomical body parts are not all there, or they have parts of male and parts of female. Okay? So that's what intersex means. I actually had a student last semester who shared with the class that they are intersex. They choose to go by the pronoun they because they don't feel like they're fully male and they don't feel like they're fully female. They present more masculine, but they wear makeup. So it can be confusing to people who see them. But they are intersex because they shared with me, or the class, that they have a vagina, but they have testes and no ovaries and no uterus. And that example I just gave you was an example of a student that was in my class that shared that last semester. Okay, so that's what intersex means. Then we're going to go on to transgender. Remember I said cisgender is someone whose brain and physical anatomy are in alignment, meaning the brain tells them they are male and they have a penis, or the brain tells them that they are female and they have a vagina. Cisgender. That's what the majority of the world is. Something we all can understand and we accept that. But sometimes the brain tells the person they are female, but they have a penis. Or sometimes the brain tells them they are male, but they have a vagina. Okay? And that's what happens when someone is transgender. Not to be confused with intersex. They have all of their internal organs as female. There's nothing that is misaligned as far as their anatomy goes. That's transgender, because if they didn't have all the correct anatomy, that would be intersex, right? So this person is transgender because the brain has told them that they are the other sex. Now, this is very important. I don't want people to think that it is a psychological disorder or that it is some sort of illness mentally, okay? The way I understood it, or what was told to me, and I understood it, and it took me a while to understand this, and I'm going to condense it down very, very small, but I'm going to give you a brief overview of the complexities of our brain. Our brain has billions upon billions of receptors, and there are millions of receptors that tells us what to do, what we hear, what we say, what we believe, okay? So as I'm doing this with my fingers, receptors are telling me to do that. It's not one receptor. There's probably millions of receptors that say, open your fingers up like that, okay? So the way that my professor told me in my graduate program was, think of your brain or those receptors as an intersection of a Los Angeles freeway. Okay, have you ever been to LA, Southern California? You see a lot of different routes coming together as one. It looks like they call it a spaghetti bowl, a bunch of light routes. So as you're traveling along this road, exit number 1 is the heterosexual turnoff. Exit number 2 is the homosexual turnoff. You want to get off at exit 1, heterosexual, but for some reason that exit is closed. That receptor is not working. So the only receptor that's available to you is the homosexual receptor. So your brain says, I can't behave like a heterosexual because it's not working for me. It's not functioning. So I'm going to have to behave. I'm going to adapt and behave like a homosexual for you. So your brain tells you, I'm sorry, I was talking homosexual, not heterosexual. That works too. Male was exit 1, female was exit 2. Okay? Your brain tells you those things. That's not your anatomical marker. So in a transgender person, although they might have a vagina, their brain is telling them that they are male. Okay? And no matter how much they try to be female, it's not working for them. Just like if you are sitting here and you are a cisgender person and you are female, no amount of force or discussion or coercion from the outside world to tell you that you are male is going to make you behave like a male, and vice versa. So just as much as a cisgender person cannot change to be a transgender person, a transgender person cannot change to be a cisgender person because there's no agreement between brain and anatomy. Okay? And again, it is not a psychological disorder because back in the 60s it was. And we had it removed in 1974 from the DSM. Okay? The Diagnostic and Statistical Manual from Psychology. That's the big Bible that psychologists use. It was removed from the DSM that said it's not a psychological disorder. It just is. It's one of those things that we just can't explain. We just accept it. Just like we can't explain, I don't know what we can't explain. I was trying to give an example. I was going to say, we can't explain why the sun comes up. But yeah, we can because we know the rotation. Anyway, so it's just one of those things. You just have to accept it. But the problem is many millions of people can't accept it. And it takes time to think about it. Okay? Trans women are the most oppressed individuals or group of people. And then here we go again with the women of color, and predominantly Black trans women are the most oppressed. Why? Because they're already on the bottom of the social hierarchy. They just can't get a break. Okay? And when we talk about trans women, the thing that bothers most people in our society is the fact that here's a person calling themselves a woman, but really is a man. I know that woman has a penis, and that's a man trying to get into the women's bathroom and do crazy, morbid things. No, it's not it at all. And I never understand why it always comes down to the bathroom. It just boggles my mind. So trans women are the most oppressed, especially women of color who are trans, the most oppressed individuals when it comes to the social hierarchy. There's a concept of passing. So not all transgender people want to have their anatomical markers changed. Their anatomical physical markers, like their penis and vagina. I don't need to have those changed. As long as they go on hormone replacement therapy let's just talk about a female who has naturally estrogen, and all people have estrogen and testosterone. So this is estrogen, this is a natural born female, and this is testosterone. So when you're a female, there's that level, right? And if you're transgender male, you want the testosterone to outnumber the estrogen so that you get more male characteristics or traits. So they go on hormone replacement therapy, and then all of a sudden the testosterone is just slowly rising, and there's more testosterone in their system than there is estrogen. The estrogen remains steady as that they've always had, and now they have more male features. Their facial hair will come in, their body hair may start to appear, muscles may get larger, all those things that they go through puberty like anybody who has natural born male would go through, and vice versa for women. If they are male and they want to be women, they stop taking They don't take it. They start taking estrogen so that the estrogen levels exceed the natural producing testosterone, and then they can, the facial hair stops growing, the voice will change, and things of that nature. Breasts will form naturally, just like a woman, a girl who goes into puberty will form. And just think about that. There are natural born women who may only be an A cup, and that may be the all they ever get. So a transgender female may only get an A cup, or a transgender female may get a C cup. It just depends on what their body chooses to produce. So why they have top surgery to have their breasts augmented and larger is strictly by choice. Some transgender women are happy just having what naturally produced as an A cup or a B cup, smaller. But some of them want larger, and so they go and get top surgery, okay? And that's fine. But if there is a transgender male, then they're on testosterone, it's not going to take away their breast tissue, okay? So they have to go and get top surgery to remove the breast tissue or the fat that's in the breast tissue so that they can actually have flatter breasts and be presenting more as male, okay? The hormone replacement therapy will not do anything about their sex organs. It will not change their vagina to penis. It will not change their penis to vagina. It will get rid of their ovaries. It does nothing to the secondary sex characteristics or physical sex traits, okay? So about 80% of transgender individuals are okay with just passing. The idea of passing means they are presenting to the world the gender or the sex that they want to present. So if this is a transgender woman who has a penis, she may be okay looking like a woman, even with her penis. Or a transgender man may be okay looking like a man, even though he has a vagina, okay? There are still some transgender individuals where it's important for them to actually change the physical sex characteristics. So they'll have what they call bottom surgery. And when they have bottom surgery, they will turn a penis into a vagina. They basically do surgery to invert it, okay? And if there is a vagina to a penis, they will take a graft of skin from anywhere on their body, like their arm or their thigh, and they will take that skin and the tissues and the muscle and form a penis and actually attach the penis there and then connect all the internal workings like the urethra and so they can actually urinate through the penis. And they will create a scrotum and put fake testicles in there, just like men who have testicular cancer and have to have their testes removed. They will have fake testes put in there for them. And then one of the testes will be a bulb-like thing that can be pumped and to give them an erection, just like a man who might have prostate cancer and had to have his prostate removed, and now he can't get a natural erection, so he has to have an implant to give him a natural to give him an erection. Okay, so all those things are very much the similar way that cisgender people perform. Okay, so that is pretty much LGBT issues in a nutshell and transgender issues in a nutshell. And this lecture is the longest, and the reason why it is because there's a lot of information that needs to be taught. And if you have questions, feel free to ask me. I'm here all the time on the Canvas email. Otherwise, I will see you next week for our final lesson. Our final lesson will be about the future. Okay, thank you. Bye-bye.